A new state report puts hard numbers and real-world context around Wisconsin's health. A 2025 Wisconsin State Health Assessment, issued every 5 years, gives a snapshot of health and well-being across the state, laying out what's hurting people's health and what communities can use to fix it. On overall health, the report says about 18% of adults, nearly 1 in 5, rate their physical health as fair or poor. About 17%, 1 in 6, say their mental health was poor at least 14 days in the last month. Young people show some of the most worrying numbers. The report says 59% of high school students had at least one mental health challenge in the past year, and about 18.6%, nearly 1 in 5, seriously considered suicide. Rates are even higher for girls and LGBTQ+ students. The assessment also flags access to care. About 1 in 10 adults say they skipped a doctor visit in the last year because they couldn't afford it. People with lower incomes, no insurance, or gaps in coverage, and those living in rural areas are more likely to miss care. State Health Officer Paula Tran says the data shows that health is about far more than just personal choices, saying in part, quote, "Good health is not as simple as making the right choices or going to the doctor alone. For far too many people across Wisconsin, making healthy choices or adopting a healthy behavior is far too difficult or even out of reach entirely," end quote. Money and housing are also big pressure points for Wisconsinites. Statewide, about 35% of households cannot afford basic needs like housing, food, childcare, transportation, health care, and taxes. The report labels as many of these families as ALICE, asset limited, income constrained, but employed. People who work sometimes in multiple jobs but still live paycheck to paycheck. The report also points to strengths. If you'd like to see the full report, we do have it up for you at WBAY.com.